Good afternoon, everyone, and thank you for joining us today at our media advisory. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. As you may know, today is National Indigenous Peoples Day, and I'd like to begin by recognizing and celebrating the rich heritage, diverse cultures, and outstanding achievements of our First Nations, Inuit, and Métis peoples. We've remained committed to engaging with the community around understanding, acknowledgement, and action. I recognize there's much more work to do that needs to be done and to address the ongoing need for reconciliation in our community and across the country. So let us all continue to learn through reading, watching films and documentaries, and engaging with the Indigenous community. You can visit hamilton.ca/Indigenous to view the Indigenous Hub, where the Urban Indigenous Strategy team has compiled a number of resources available to get you started and moving. I'm wearing orange today in respect of the Indigenous Community Peoples Day, and I encourage everyone else to celebrate with a little orange in your life today as well. Moving into the COVID-19 update, Hamilton's vaccination effort continues forward at a significant pace with 463,763 doses administered so far. About 72% of our population age 18 plus have received their first dose. And from that group, about 22% have completed the vaccine series or double doses. And for the 20 to 17-year-old age group, 55% of them have received their first vaccine. And the province is accelerating eligible Hamilton residents to book a second dose. And I know Dr. Richardson will spell out chapter and verse on what's happening today and what's happening on Wednesday and thereafter in terms of eligible second doses. But it is important to get your first and second dose, completing the vaccine series. And we encourage people to get out there and get that vaccine. It will lead us to a quicker, better return to the things we enjoy doing in our broader community. Unfortunately, some of those things have opened up recently, but we need to have more vaccinations and lower case counts to continue to be able to do that. Our public health continues to work with our school board partners, McMaster University Children's Hospital, on a plan to vaccinate youth 12 to 17 years of age in Hamilton. That's about approximately 37,000 youth in our community that need to be vaccinated. And ages 12 and older at the time of vaccination can book an appointment to receive a Pfizer COVID-19 vaccine. So there are many convenient ways you can receive a COVID-19 vaccine in Hamilton, including our large-scale clinics, our mobile pop-up clinics, pharmacy clinics, family and youth-friendly clinics, and community-based mobile vaccination clinics for specific populations. So to learn more about how to access vaccination for youth who are in hospital or those who are homebound by medical reasons, specialized supports clinics for these youth in the community, information regarding how to book and answer to frequently asked questions regarding your youth COVID-19 vaccination can be found at hamilton.ca/youth vaccine. Vaccinating community members remains a critical tool and top priority in stopping the spread of the virus. So additional clinics and increases to access of the vaccine at a variety of locations across our city is very, very important. And again, for more information on that, please visit hamilton.ca/vaccine booking to book your vaccine appointment. Now I'm going to turn it over to our Emergency Operations Center Director and Distinguished Citizen of the Year, Paul Johnson.
Thank you very much, Mr. Mayor. And I want to thank you for starting your remarks today and recognizing National Indigenous Persons Day. As you know, I have the pleasure of working on our management group with the lead on our urban Indigenous strategy, and to the staff that I work with who continue to teach our organization about how we can be better stewards of the land that we share and better partners in terms of working with others, and to the whole community. I will commit today to doing some of my own private reflection on how I can continue to learn and be better in those ways, and certainly echo your calls for that as well today. But I do want to say thank you for the staff that do incredible work in this area across our department. We remain in step one of the province's roadmap to reopen, and I know people are enjoying patios. I know people are enjoying the return to retail, willing to stand in line where We didn't in the past have to stand in line because of capacity issues. And so that all is good news about people recognizing that we can do more activities and wanting to get out and do that. Please recognize that we remain in this pattern at the moment. There's lots of chatter in media and on online outlets about how fast we might move into the next step, but there have been no decisions taken on that. So prepare that it's going to happen in the time frame that's already been laid out, and listen to sources like ourselves and others who would make any changes to that as well. Also really important to continue to utilize all of those good public health processes and the advice that we receive in terms of how to stay safe. We are excited though, we're about a week away from some more things happening in recreation, some opening of our outdoor pools and the Dundas wading pool that will start on the week of June the 28th, so next week. And the other wading pools will are scheduled to be open the first week of July. And we're also getting prepared for a year of summer camps. And it's wonderful to be saying that. So both our summer camps and SUPE programs are scheduled to begin on July 5th, assuming all goes according to plan with the province's steps to reopen. And just so you know, there's a bit of a new approach to SUPE this year, in recognition that we're still in a bit of that transition with COVID-19 in our community. And so there will be a combination of staff-led programs and passive activities. So the passive activities are great if you still aren't comfortable with a group setting. There will be a number of activities that you can do with members of your own household at your own pace within those locations. And so we recognize that as we build towards fewer and fewer restrictions in our community, that people's risk tolerance and their comfort level will be different. And congratulations to our rec staff for recognizing that and developing some programs that will not exclude those who are still building up their readiness to be in larger groups, or perhaps have reasons why they feel it is not safe for them to be in those larger groups. Our staff-led programs will have limited spaces. You will need to sign up, and you can find out all the information about our camps and our SUPE programs at hamilton.ca/recreation. So again, great opportunities for that. We've had a number of questions come in more from groups around these day camps and what they're allowed to do, and a little bit of a misunderstanding about the fact that day camps are allowed to use in certain circumstances indoor facilities. This is a recognition that at times inclement weather will require people to be indoors. And what we don't want to do is cancel camp days and only be able to be outside when the weather is right. The expectation from the provincial government is that camps are primarily outdoors. And when they are indoors, that they're not all the activities that you might be able to do indoors. The biggest one of that is around sports. So when camps are indoors, there will not be athletic activities taking place. This will be more about relaxed and calmed activities in an indoor setting when, of course, the weather forces camps to be in those indoor spaces. We also can't have sports programs calling themselves a day camp and simply running sports programs indoors. So some of the hockey and ice skating and other sports that are played predominantly indoors are not at this stage allowed to be a day camp and have those activities taking place. This is really to promote the more traditional broad-based day camp programs that offer a variety of activities to young people. But the expectation on those day camps as well is that that's predominantly taking place outdoors. So lots more coming each and every day about how we're going to return to team amateur sports and team sports that are outdoors. We'll get some more information about that shortly and be able to provide that, because we do expect that heading into July, there'll be lots more opportunities for team sports, including playing of games or having scrimmages. And that will be great opportunities, again, for people to be involved, and not just in that small group training scenario, but actually getting out and doing what we like to do, which is compete and participate in these fantastic opportunities. Our enforcement folks continue to be out. Much of our enforcement these days is around the traditional activities of whether COVID-19 was in our community or not. We'd be out enforcing primarily around our waterfalls and some of those outdoor areas where there are restrictions on where people can go. But just a reminder to all of our business owners and to individuals, please adhere to the guidelines that are in place today. They're there for everybody's safety, and we will move to have larger and larger gatherings. There will be a time at some point in the future where indoor gatherings are permitted, but at the moment, indoor social gatherings by individuals are not permitted, and it is only outdoor dining that is permitted in restaurant establishments at this point. But we're doing a great job, and as I was out and about in the last little while, watching the enthusiasm for people and the lineups, both at our retail environments and our restaurant establishments, I think everybody is taking this very seriously. They want to be open for business. We don't want to slide back into any other situation, which would be more restrictive. And so I'm glad to see people enjoying that, and I hope that it's choosing to be lucrative for our businesses who need some of that injection, obviously, of cash into their pockets, so that they can continue to grow as their operations are allowed to reopen further as we go forward in the next few months. With that, I'll turn things over to Dr. Richardson.
Thanks so much, Paul. So I'm going to give you the overall case stats as of today, and of course it continues to be good news with 21,150 cases in total, but a net change of just 7 cases from yesterday. And so our case counts continue to be lower than it was during the stretch between waves 2 and waves 3, which of course is very good. And this is the what we want to see us recover, particularly in our hospitals and our ICUs, and get those rates well down, so that we can get other critical services back up and running, which we know are in significant need here in Hamilton. The average number of new hospitalizations as well is trending downward, and as well the average number of deaths occurring per day continues to be low. So the official stats are 17 cases reported per day on average in the last 7 days. The weekly incidence is sitting at 19 per 100,000, and our weekly reproductive rate is now down to 0.64. Currently, there are just 5 active outbreaks with no new outbreaks to report today, and the magnitudes of these outbreaks continue to be lower, and most of them at this point are occurring in workplaces. The good news as well on this front is our percent positivity is trending downwards. You know, this had lagged a little bit for us here in Hamilton. We're now at 3.5%, and we rank 4th at this point amongst all public health units in Ontario, according to the data from ICIS. Last week, we were announced as a Delta variant hotspot, joining 9 other public health unit catchment areas as having higher rates of Delta variant transmission. And this was based on data and analysis that had been done by Public Health Ontario and the Ministry of Health. We do know last week that Public Health Ontario had detected about 16% Delta prevalence in the samples they tested from the week of May 23rd to 29th. And overall, as of yesterday, the science table was estimating about 1/3 of cases of COVID-19 in Ontario are due to the Delta variant. So we're continuing to monitor the situation as it pertains to the Delta variant. We do know there are concerns about the Delta variant spreading more easily. And of course, this is the challenge we had faced with the Alpha variant in wave 2, going into wave 3. And so this is something we're closely watching. So even with these indicators all going very much in the right direction, which is very good, and our vaccine coverage rates rising, it is still important to follow our public health measures, making sure that you are physically distancing, to wear a mask if you're in an enclosed space or outside when physical distancing is impossible. And of course, if you are feeling unwell for any reason, to stay home. If you have COVID-19-like symptoms, to please go out and get a test. Everybody's vigilance is so important as we go through this stage of the pandemic. We definitely want to make sure we keep moving forward and experiencing the benefits of a further reopening together. So on the vaccine front, you heard from the mayor, 463,763 vaccines have gone out locally, giving us a 72% vaccination coverage amongst those who are over the age of 18, and an estimated 55% of youth aged 12 to 17 have received a vaccine to date. Overall, our second dose coverage is sitting just under 22% for adults over the age of 18. It is important to get vaccinated as soon as you can in terms of booking in your second doses. As we know, with the identification of Hamilton as a Delta variant hotspot, we are now eligible for accelerated movement through the second dose eligibility to give maximum protection against COVID-19 and its variants. So starting this morning, anybody who received an mRNA vaccine on or before May 9th is now eligible for that shortened second dose booking. On Wednesday, anybody who received an mRNA vaccine on or before May 30th will be eligible. And by the end of next week, everybody over the age of 18 will be eligible to book their second dose appointment as long as it's 28 days after their first dose. So you may be asking, what vaccine is it that I'm going to get when I book in for that second dose? And we continue to move through with a significant amount of supply. It is, though, coming in batches of either Moderna or Pfizer as it comes forward. And we're seeing definitely an increased supply of Moderna during this phase. Thanks very much, of course, to the federal government working with suppliers. So in comparison, Pfizer is going to be slightly decreasing over the coming days. So when people are going for appointments, it's important to know that both of the mRNA vaccines can be used. They're interchangeable. They're both safe and effective. They're both going to give you excellent coverage regardless of which type of vaccine you got for your first dose. And so we very much encourage people to take a dose of vaccine that they're offered as soon as they are offered it, rather than waiting for their next dose of vaccine. This is whether your first or second doses. There will be times in our clinics where if you're going there, you will not be able to ask for a Pfizer vaccine if that's what you got earlier, except for those that are between the ages of 12 and 17 years. And so we are reserving our Pfizer for the use in that age group. That age group can only at this point have the Pfizer vaccine. And so it is important that we reserve it for our youth who are between 12 and 17. We will make sure that when you arrive at the clinic that you're aware of what vaccine you may get. But as I said, we won't be able to switch vaccines at that point. There were a lot of announcements last week about vaccine eligibility and what had been happening with those. And one of those was also about AstraZeneca. And of course, now anybody who has had a first dose of AstraZeneca, the preferred second dose is now an mRNA vaccine. And so you can book in to receive one of those if you're at 8 to 12 weeks after your first dose. And you can do that through a pharmacy or by booking into one of the clinics through the provincial portal. If you did go ahead and have 2 doses of AstraZeneca vaccine, that is all well and good as well, and you'll be well protected against COVID-19 as well. So if you're looking for vaccine information, you can continue to find that on www.hamilton.ca/vaccine booking. We do update that page regularly with the most up-to-date information. And of course, we also do continue to load vaccine appointments as soon as they're available to us. And you can find new ones there. So do check back regularly as we're regularly adding extra appointments to that portal. So with that, Mr. Mayor, back to you.
Thank you, Paul. Thank you, Elizabeth. Certainly the warm weather gives us all another reason to venture outside, but getting your vaccine and completing your vaccine series will move us closer to the next stage, the next opening stage. So please do your best to get your vaccine as soon as possible, and lots of booking availability in the next coming weeks. So I know many people are coming in or calling in and saying, got my second dose. I think that's an exciting moment for them, an emotional moment for a lot of folks, and certainly spells hopefully some significant change going forward. So thank you for doing your best, protecting your family, your friends. All of that is important in terms of getting the vaccine. So go to the next step and get your second dose as well as soon as you can. It continues to be a collective effort. The folks in the vaccination centers are doing a terrific job of making everyone feel comfortable and very efficiently administering second doses. And we all know how much people love to get a needle. But the reality is that there's good reason to do so. And you're really doing a good service to your community and to your family as well. So please do take advantage of all the goodwill that's in our vaccination centers. The good people that are working there, very upbeat, very enthusiastic, very kind, and they'll get you in and out of there as quickly as they can, and they're very efficient. So I don't have anything more to add to that. I'm going to turn it over to Jen for some media questions. Jen?
Thanks very much, Mr. Mayor. We have 4 media partners joining us today for the media briefing. As usual, we'll start with one question and one follow-up for each reporter. First question goes to Bobby Rostova from the CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a great weekend. My first question is for Dr. Richardson. Are we seeing a trend of people leaving or canceling their vaccination appointments for that second dose because they got Pfizer and they want to keep Pfizer? Or are we seeing people leave because they want the same vaccine twice in a row?
Hi there, Bobby. At this point, we are seeing some cancellations. Mostly what that is that they've booked in their vaccine through a different route. So they would have gone to the pharmacy, or they would have gone to primary care, or they would have gotten an earlier dose than they had planned for. So that's where the majority of those kind of cancellations are coming from. We've not really seen a lot in terms of people canceling related to the vaccine that's available at this point.
Thank you. And my second question, do we know how many people are coming from outside of Hamilton for vaccinations and how many are coming for leisure or other reasons?
Yeah, in terms of people coming for vaccinations, fortunately, as part of the provincial reports, we do get information on that. And so there are a significant number of people who do come into Hamilton to get vaccinated. Of course, because we're on the provincial system, you can book your appointment anywhere in Ontario that uses that system. So we actually also have Hamiltonians, of course, that go outside of Hamilton to get vaccinated. And so in that exchange, Hamilton actually ends up having more people vaccinated through other routes than we do people from outside, as it turns out. So definitely a trade-off in that. And that can happen, of course, when people are getting vaccinated somewhere that's closer to work, when it's somebody who's still going into work each day rather than working from home, or it might be a setting that they're familiar with that they'd like to return to. But it is actually working out in Hamilton's favor in terms of people being able to access a vaccine wherever they can across the province through that provincial portal.
Thank you.
Thank you, Bobby. Next question goes to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks very much for taking my question. I'm wondering, with so many more Hamiltonians eligible this week, what's being done to ensure there's enough available appointments as quickly as possible?
Thanks, Matt. So as we go forward, we continue to add appointments to that vaccine booking system as soon as we get confirmation of those doses coming through. One of our key pieces has been that we have not wanted to have to cancel vaccine appointments. And so we continue strong with that approach, and it stood us in very good stead. And so you'll see about 35,000 appointments added in the next day or so to that provincial system. So we'll keep going forward at that rate. It is going to take us a bit of time to move through and get everybody vaccinated with their second doses, sitting at about 22% today. So we've got a fair number of Hamiltonians to go, but we're very pleased with the vaccine supply that's coming through. We're operating many of our clinics right close to maximum capacity. And so we'll keep doing that as we push forward.
Thanks very much. And I was wondering as well, with this new eligibility and so much vaccine coming in over the next few weeks, does public health have an idea of when you think you might be able to completely vaccinate every Hamiltonian who wants it? I know the Prime Minister has said September for a long time, but there have been some questions about, is that further than it's actually going to be? Is it going to end up being sooner?
Yeah, thanks, Matt. We definitely see a strong supply coming through. We'll be able to get, many doses out through the end of this summer, really, and getting our rates well up into the mid 70s by the end of this summer for 2 doses. I think that the ongoing piece for us, of course, is making sure that this is a very equitable and accessible vaccine program. And so working with those who are finding it difficult to reach the vaccine, who may have particular concerns that they want to discuss with somebody from their community, from their primary care provider, that's really going to be more and more a focus of our program as we go forward, working with people who don't quite understand the information, may want to see a little bit more in terms of what happens with the rollout, and working with them to give them as many opportunities as possible to get vaccinated.
Thanks very much, Dr. Richardson.
Thank you, Matt. Next question goes to Joanna Furketich with the Hamilton Spectator. Joanna, you can go ahead.
Thanks very much. I hope everybody had a great weekend. Halton tweeted out on Sunday that it only has Moderna now, so all of its clinics starting today will only be providing Moderna. Is Hamilton in the same position? And if not, how much Pfizer do we have?
Thanks, Joanna. We still do have Pfizer on hand, and that's really important for us in terms of, as I was saying, vaccinating our 12 to 17-year-olds, because that is the group that that's the vaccine that group can have. Moderna has not yet been approved for that age group. So we're reserving our Pfizer by and large for that particular group. And most of our supply at this point is Moderna as we go forward over the next week or so.
Thanks so much. The province said Thursday that it has made clear that it wants public health departments not to hold back any vaccine supply, that there's the 7-day supply is to be used within 7 days, and that if you need more vaccine, you can ask for it. So I'm looking to find out, has Hamilton asked for more vaccine? Are you able to get it all into arms within the 7 days? And are you holding any back?
Thanks, Joanna. Yes, that's been the approach throughout, is making sure it takes me back to the days of General Hillier, where he was very clear that we wanted to have that vaccine in arms as soon as possible. And so we've been keeping the course with that throughout the whole vaccination program. We are there are targets that the province sets of how much vaccine to go through, and we are meeting those consistently in terms of getting it out within that 7-day time period that you're speaking to, Joanna. We do make sure we have a day's vaccine on reserve to go into the next day. And so overall, that ends up, as you can imagine, because you've always got that 1 day, that 7 days worth of vaccine is going out in 7 days. So that's been a really critical part of the program as we go forward. In terms of asking for extra doses, because we're a Delta hotspot this week, we're automatically given extra doses at this point. And so we're just working through, now that we've got those, exactly when and where those will be allocated, and we'll be happy to get those out into arms very soon.
Thanks very much, Dr. Richardson and Joanna. Next up, we have Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My first question is about getting sort of maximizing people's chances of getting a vaccine as early as they can, the second dose. So is public health recommending, signing up through the provincial portal, but also calling pharmacies and looking at local clinics and keeping an eye on vaccine hunters? What does public health recommend?
Thanks, Katrina. Yeah, I can imagine for people, there are a number of different places to look at in terms of where you could get vaccine through. So, the strategy of booking in and getting an appointment is the most important one. Whichever site you decide to use to do that, whether it's through the portal, whether you decide to use vaccine hunters, or go through the pharmacies. So, part of this is about, where do you feel comfortable getting vaccinated? Where's the best site for you in terms of getting vaccine as well? Some people feel more comfortable in a particular setting, but it's essentially just making sure you go and get an appointment at the first place that you're able to do that.
Thanks very much. And then my next question is regarding how many people, I'm wondering if public health knows how many people are newly eligible this week for their second dose. And then also, is there, I know you sort of touched on this, but is there a concern that what happened last time we sort of opened up widely, where clinics filled up within a few hours of people being able to sign up? Is there a possibility that might happen again, say on Wednesday?
Yeah, I think that's our concern always as we go through this, is we do see that pattern that our appointments do fill up pretty quickly. Sometimes it's a couple of days, sometimes it's shorter in terms of what happens. And that's why for us, we are constantly doing that work, both in terms of once we get the confirmed allocations, we get those up onto the website so that people can book into them. But also, just as you're talking about with Joanna just a moment ago, when we're looking at getting our vaccine out within 7 days, if we see a particular clinic has had some no-shows or anything like that, we do put those appointments back up as soon as we can as well. And so that's why we do encourage people to check back. You'll see sometimes some added appointments that have been put in within the week in order for people to book in. So we're just constantly working to get every vaccine appointment that we possibly can up there so people can book.
Thank you, Dr. Richardson and Katrina. We do have a bit more time, so we'll run through the reporters once more if you'd like to each ask another question. First question goes to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you again. This question also for Dr. Richardson. You're popular. My question is, based off the trending we're seeing here, is there a certain timeline or a date in which you expect we might actually see no new cases here in Hamilton?
Bobby, that's the $64 million question, I think, as we go forward. You know, one of the questions is about whether or not we'll get the rates of COVID right down to zero. And, you know, would that last for any particular point in time? Or are we just going to have this continued low level number of cases as we go forward? That's what we call endemic in terms of the virus just sort of circulating in at a lower level state. Or will we continue to have variants that get generated and then to continue to see some of these waves or swells, as we've called them more recently, as we go forward? So that's something we're all going to be watching together around the world and seeing what it is that happens. So no predictions as to the zero case state, but certainly as we move forward, you know, people getting vaccinated as quickly as possible, that's our best protection that we have right now.
Thank you. Next question goes to Matt Ingram from CHCH News. Matt, you can go ahead.
Thanks very much. Just kind of building on one of my last questions, Dr. Richardson, I'm wondering if you could tell me a little bit more about what goes into making more appointments available. Like, is it a question of staffing or resources or locations? I guess how with so many more people eligible, what are the actual steps that you take to get more appointments available? Or are we at the top of how many appointments are available based on our resources?
So right now, you know, we have the three clinics that we've been operating for some time now at St. Joe's up in West 5th, that we have the clinic that's operating at First Ontario Centre, and we have the clinic that's been operating at HHS for some time now. And you'll know that HHS has been doing some dedicated work around youth during these last 2 weeks. And so they've been great about doing that. We also, of course, added ArcelorMittal Dofasco. So sometimes we are able to do that, work with a partner and add a new kind of clinic or a new kind of community-based clinic, as we've been adding as Refuge has taken over the operation of the clinic at Restoration House. Detroit de Desnay is working with the Perkins Center. And so we're always looking to work towards this sort of sustainable program of vaccine distribution for COVID-19, because we know it's going to take us some time to continue to do vaccinations for all that would want them. And so that's part of the strategy that we're working on, is bringing on more community members. We're working with our primary care colleagues, of course, as well in terms of that. And with places like long-term care homes, retirement homes, hospitals, how can they get vaccine in place where they can vaccinate people who are newly arriving at their facilities and who need vaccination? So we're working on it on that front. At the same time, we continue those pop-up clinics that are happening as well, and we need to balance where we think coverage rates are already at a good level and where they're not. And so we're targeting those vaccine clinics, those pop-up clinics in areas with lower coverage and with good success in terms of bringing up rates of coverage in those areas, but still a lot more work to do. So you can see it's a pretty complex piece as we're looking to get as many vaccinations happening as possible. Our large scale clinics continue to be the ones that operate most efficiently and get the most doses out and accessible for people. And so that is where most of our vaccine does go, but we're continually looking at where other sites are that can increase our capacity overall, improve our sustainability, and help us to get vaccine out to everybody who needs it.
Thanks, Matt. Next question goes to Joanna Furketich from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. I really appreciate it. We've been hearing reports of people making multiple appointments and not canceling their early appointments, so they just don't show up at their second dose appointment. How big of an issue is this in Hamilton, and how does that affect the clinics?
So the whole piece about booking the second appointment is a little bit complex, and so it depends on where you booked in terms of the approach. So if you booked on through the provincial portal, then what happens is that if you decrease the interval to the next vaccine, you book an earlier appointment. In other words, then that previous appointment will automatically be canceled out. If you booked in and got your vaccine at a pharmacy, that might happen at the time that you get the vaccine, but it is a circumstance where going in and making sure that second dose vaccine appointment is canceled is really helpful if people can do that and make sure that's happened. If you booked though through the city's hotline or through St. Joe's hotline, you do need to call back and cancel those appointments. And so if people can do that, we really appreciate it because then we can open up those appointments. Those can be part of those ones that we add back in for other people to book into. So it's certainly happening where we're having appointments that people aren't showing up for. It's something we want to minimize as much as possible. So if you can double check, make sure your appointment's canceled out, that would be great.
Thanks, Joanna. Next question, final question goes to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thank you. I'm wondering if we know how many people are going to be eligible, newly eligible for their second dose come Wednesday.
I don't have that with me right now, Katrina. We can see if we can get that to you.
Thanks.
Thank you, everyone. And with that, that is the end of our media questions for today. So, Mr. Mayor, I will send things back over to you.
Thank you very much, Jen, and thank you to Bill Custers and the entire team at Cable 14 and Clear Cable who help us put these advisories together, and to our media partners who join us every week and help ensure that those important questions are asked and hopefully answered to help inform our community in terms of what's going on relative to COVID-19. So for more information on any matter relative to COVID-19, financial supports, or any updates, visit our hamilton.ca/coronavirus website. And please continue to follow all the public health measures like physical distancing and masking when you're in contained or indoor locations. It is still wise to maintain vigilance around those measures because that Delta variant is out there and it is contagious. And we want to keep that from spreading in our community. So please continue to follow that good public health advice. This is the right time to continue that, even if you've been fully vaccinated in places or spaces that you're not familiar, or indoor spaces that you are in that would get you into contact with folks that may not be fully vaccinated at the time. So continue to keep your appointments as well. That's very important. And we want to make sure that all the vaccine that we have gets into the arms of individuals for their protection. So thank you for fulfilling your bookings and for taking that vaccine and continuing to keep the public health recommendations in the forefront of your mind as you navigate this new circumstance, new openings that are currently happening in our community. Thanks all today for paying attention and tuning in, and we will see you next time on Monday, June the 28th at 3 o'clock. Be well. Take care.